Continuing education credits for physicians and other healthcare professionals is provided by VCU Healthcare Continuing Education. Check out cribsiders.vcuhealth.org for more information.
The Cribsiders podcast is for entertainment, education, and informational purposes only. The views and statements expressed on this podcast are solely those of the host.
Welcome back to the Cribsiders. I'm Chris the Chew Man Chew, and I'm joined tonight by my producers and my friends. I have Abram Rago.
Yes. Hey.
Cindy Engel.
Hello.
And Joan Park.
Hi.
And actually, Joan's been awesome because she's basically been our super producer and our AAP liaison and got all our AAP episodes together, so it's been fantastic. So tonight is one of our episodes here from AAP about the 2024 conference. We are reunited with our special guests, Dr. David Hill and Dr. Joanna Pargo-Blinky. You may know them as the hosts from the Peds on Call podcast. And they're going to talk to us about what they learned so far. They've been the co-hosts, the MCs for the AAP NCE, what does the NCE stand for again?
National Convention and Experience Exhibition.
For like what they said, 5 years. And so as the MCs and the co-hosts for the plenaries, we had a great discussion with them. And before we actually get into it, Sydney, do you want to remind us what our podcast is about?
We are the Pediatric Medicine Podcast. Usually on this podcast, we interview leading experts in the field to bring clinical pearls, practice-changing knowledge, and answer lingering questions about core topics in pediatric medicine. Today is different, however.
We have a fantastic conversation with our guests, Dr. David Hill and Dr. Joanna Parga-Blinky from the AAP's Peds on Call podcast. Dr. David Hill is a hospitalist pediatrician, podcaster, author, editor, speaker, and consultant in the fields of medical communication and children and media. He is also currently a Democratic candidate for North Carolina Senate District 7. He lives in Wilmington, North Carolina with his wife and 4 rescue dogs, and he has 5 now adult children. Dr. Joanna Parga-Blinky is an associate professor of pediatrics and clinical neonatologist at both the Children's Hospital of Philadelphia and the Hospital of the University of Pennsylvania. Her medical education has been bi-coastal, from Mount Sinai in New York City to residency at CHOP and neonatology fellowship at UCLA. She returned to CHOP for her first attending position, wanting to be closer to family and to live in an affordable city. She enjoys work in media and specifically in podcasting. Her very first podcast, co-created with Dr. Diana Montoya Williams, was called Baby Doctor Mamas, focusing on educating families on infant care.
So let's give him a ring and hope it doesn't go to voicemail.
Nice.
On call.
Thank you.
Clever.
Gotcha. Well, yeah, because you don't page people anymore, right? So you just
Unfortunately, I still get a lot of pages.
Oh, okay. And here is a quick thing. The beginning of our discussion, we had some technical difficulties, so the audio quality will be a little subpar, so I apologize for that. But please stick it out for the first couple minutes. You can still be able to, you will still be able to understand what they're saying, and the audio quality will improve after a couple minutes. So I deeply apologize for that.
Hi, Dr. David Hill and Joanna Parga-Blinky. Thanks for having us at the AAP conference and coming on the show. We've all learned so much already. We're not even done with day 2. To start off, because we're an informal group, are you okay if we call you by your first names?
Absolutely.
I have to think about it for a second.
We can work on the pronunciation later. we like to start with some rapid fire questions to get you all know a little bit better. Could you all give us a one-line about yourselves a little bit more so our listeners can get to know you a little bit more?
Sure. Mother, podcaster, pediatrician, and person.
Yeah. After you say person?
Yeah, I should have said neonatologist.
Person's good.
Yeah.
I like that. That's very specific. I am a father of 5 adult kids. Now I'm an author, a speaker, a consultant, a pediatric hospitalist, and sometimes a community physician as well.
Our listeners may remember from like 2 years ago when they were on our show, and also they were now on other podcasts. Peds on Call, right?
Yeah. I've been on it a few episodes.
So I have a question. Can you give us a recommendation of a piece of media, medical or otherwise, that you have been enjoying lately?
You enjoy so much media.
I do usually enjoy a lot of media. I'm like trying to think of something medical that I enjoyed recently. And I also get told by the residents that I give them like a lot of like medical context for things. But so on my to read list, because I just gave a health equity talk for our neonatology division for the fellows, is Legacy by Dr. Blackstone. So that's like something that's medical that I really want to read, that's on like health equity, and it's like a Black doctor's experience becoming a doctor. I haven't read it yet, but it's on the list. So anyone who wants to read it and do a little book club with me. But the thing that I did read was Cast by Isabella Wilkerson. And I was recommending that to this last group that I talked to about understanding racism in America. So it's a heavy topic, but I think a really important one, and probably the last thing I recommended to any students.
All right. You really took that another direction, because I was trying to decide between Hats and Bad Monkey.
Neither of which I have seen.
But if we're talking about reading that everyone in medicine should read, then I have two. One is Daniel Kahneman's Thinking, Fast and Slow, because we both encounter cognitive errors and heuristics in people all the time, but we also learn them ourselves, and try to put up some guardrails on that and figure out when I'm using a bad heuristic, or even pronouncing that word correctly is a thing. And then I would also say a lot by Jonathan Haidt, probably the
The Anxious Generation. So if we're not talking about media, which I think we might, because the 5 C's were in the plenaries.
Yeah.
But his book, while interesting and informative, I think is very fear-based. And it's one of the things that Megan Moreno was talking about that we have to be cautious of, because we need solutions for how we tackle media. But everyone's read it. And I think there's total validity to the message. It's just like, how do we move forward from there, you know? Because I think it's one thing to call out a problem and another thing to like be solutions-based about it. And did he have a different?
I did. No, it was an earlier one. The Righteous Mind. That's it. Just The Righteous Mind.
I jumped in.
Yeah, no, it's good. You took it in a good direction. I like it. I like what you did. But it's a little bit early. And again,
well, he's an NYU professor, right?
Yeah.
He has some interesting.
I have to agree with you that I think our friends Megan Moreno and Jenny Radesky would agree that his case in his most recent book is perhaps overstated and flattened a bit, but he's still a thinker that I read.
Great. No, that's awesome to hear. I always love hearing people's recommendations. So let's jump right into the plenaries, if everybody's okay with that. So we are so excited to be here with you all again, a little mini reunion. And I was kind of concerned that maybe this wasn't going to happen because of the hurricane, but so glad we all made it here. How has it been for you all so far?
I was really worried I wouldn't make it either, but then my flight took off on time and landed on time, which it's funny that like the expectation is that's never going to happen if flight travel anymore. So I was pleasantly surprised, but I'm like very saddened seeing all the footage of how communities around where we are right now have been affected by Hurricane Helene.
And I honestly almost didn't make it. I got in at 1:10 in the morning the day that we were supposed to go on stage, and got to bed at 2:30, and we had a wake-up time of about 6. So the fact that anything I said came out at all coherent was problematic. But now, turning back to my home state of North Carolina, our hospital is looking at trying to airlift medical supplies into the Asheville area, because that's the only way to get them there. So my area, Wilmington, which usually gets just walloped by hurricanes, came out with pretty much unscathed. That the Asheville area is a different story completely. So our thoughts are going out to Western North Carolina. We're all trying to figure out what we can do for them right now.
Thank you for sharing us that. I feel like watching as it kind of, in my mind, I was just focusing on Florida to like make it to the conference, but you're right. Throughout the conference, I've been kind of getting notifications as it travels north.
Open Evidence is the premier AI-powered medical information platform for medical providers. It is designed from the ground up for you to get trustable, verifiable, evidence-based answers to clinical queries. Open Evidence is used in over 7,000 hospitals and care centers in over 150 countries. Grounding in high-quality literature allows physicians to have the ease and flexibility of ChatGPT while also being actionable and verifiable. So I've used Open Evidence in 2 ways. First, to find primary literature. For example, you can ask it to find the most recent guidelines on pneumonia, asthma, or any medical disease of your choice. Or it can help you find that article's at the tip of your fingers, but you just can't remember the title or author. But what impressed me the most is you can ask Open Evidence to read a guideline for you. For example, you can ask Open Evidence various questions about the 2021 AAP febrile infant guidelines, and it will give you a summarized response about lumbar punctures, antibiotics, anything that you might ask. So Open Evidence is solving medical search for providers everywhere. If you haven't tried it yet, go ahead and check it out at openevidence.com/Cribsiders. It's free to all of our listeners. To help save you time and help make better decisions, go to openevidence.com/Cribsiders.
So thinking about the theme here, the theme was show your true colors. And I loved that, the performances by the choir as well as the dance performance was so beautiful. Do you all know what the inspiration for the theme was?
I think we all know that it's hard for pediatricians in Florida, that there are things that are not medicine and are not evidence-based that are creeping into our practice. And it's hard. It's hard when we can't provide children with the quality care that they deserve, and we can't treat them as individuals, and we can't support their growth and development and help them thrive. And I think the True Colors theme is really speaking to that and how difficult it's been for pediatricians here to be delivering the quality care they want to their patients.
It was very controversial bringing this meeting to Florida, and it was actually the Florida chapter of the AAP that was instrumental. They said, please support us. Please help us not feel abandoned. We want to know that the work we're doing matters and that our voices are heard, and there'd be no better way than to be surrounded by 10,000 of our peers. And so I think we've taken every opportunity in planning and executing this to let them know that we got their backs, that we know they're fighting for the best interests of children and families against a politicized process that has made their lives more difficult. And we just wanted to, fly our colors of support for the pediatricians and families here that are working in a somewhat hostile environment in some cases.
And I think there was the video in the plenaries of the pediatricians all saying thank you. Those were all Florida pediatricians. That was on day one. And then today we got to hear from these pediatricians about some of the things that they're really struggling with in their practices and how grateful they are that the AAP has come out for them. And I think it's going to lead to really hard questions about how do you throw these big conferences where you're inviting a lot of people to come together and learn and grow. How do you keep them safe? And where do you have them when there's like a limited number of these kind of conference halls throughout the country too? And I don't know what the right thing to do is because, politics change and environments change and it's going to be hard to keep on top of where conferences happen next. But I think the AAP is really sensitive to that. And they even put in extra safety protocols and other things here.
And the lead time on these conferences is like a decade. So when you pick a state or a place, you do not know what the environment's going to be there when we finally get there. And we've seen rapid change in the environment here and hope that we will see change maybe go a different direction as well.
And we don't know what climate change is going to do, so it is really hard. And I think we do have to be where pediatricians are. So I'll say that.
Awesome. So my first question, Dr. Benjamin Hoffman, who, he gave the president's address, and it was amazing. He first started talking about his family, how, he had, a Jewish family, but was also a mixed family where they adopted several. They even had their epileptic dog, and then moving out to, I forget, was it Colorado or Utah or somewhere?
It was New Mexico.
New Mexico.
This is actually what's the nuclear, Los Alamos.
Oh, yes, Los Alamos. That's right.
Los Alamos.
And just sort of understanding where he came from and sort of what has been driving him and some of the ethos that he's had. And then he came out and talked about pediatricians as heroes. Can you guys speak to a little bit about that? He made a good show of it. He had this great Captain America shield with pediatricians heroes, like a physical prop. And I was just wondering what your guys' thoughts on it was.
Oh, I mean, come on. What a great framing mechanism. I've had the incredible experience recently to hear back from some patients that I saw many years ago telling me about things that I had very much forgotten that I did, that were intensely important to their lives, in some cases life-changing. And, we just go work. We do what we do. We don't know. You go to the room, you go to the next room. And to have this opportunity to hear back from people that I saw, 10 years ago about the moment that things changed for them. And the thing is, I'm not doing anything special. I'm not doing anything that all of us are not doing many times a day, every day. And I wish we could all get that experience of hearing 10 years later, that thing that you said to me changed how our families and our children's lives were. That moment that you paid attention or listened or went the extra mile. And what's special is that it's not at all special. It's just us doing our thing every day.
And Ben Hoffman is a huge superhero buff. I don't think that came out in the speech that he's like a big Marvel fan, I think. I didn't ask him specifically what his favorite superhero is, so you'll have to interview him for that. But I love that theme. The AAP used that theme for vaccines too, like in a vaccine ad a few years ago. But Ben Hoffman's a big superhero advocate, I guess. And his story is just incredible. I mean, we were outlining his story. I mean, and so it's amazing to have him in this leadership position with his perspective and his view of like really wanting till the end to help kids.
He must be a lover of quotes too, because he had lots of great quotes. I think one though that sort of hit home that both Joe and I took note of when we were taking notes during the plenary was from Paul Wise. It was, "Pediatricians are the ultimate inheritors of failed social policy." I was sort of wondering what your thoughts are on that.
It feels like a lot of what we do is out of our control sometimes in practice, right? Like we have control over writing medications, over writing notes, over some of the conversations we have, at least for me as a neonatologist in hospital with families. But I don't have control over what happens outside the hospital as a neonatologist and a pediatrician. And so much of what I hope for my families is caught up sometimes in systems that are not medicine, but are systems of the structure of society. And so that's why I think, and Dr. Hoffman said this really well, that's why we're so well positioned as advocates, because we see people come in. We treat families, not just children, right? So we see families come in with needs that are affecting their health, and it puts us in a position to speak for them, to speak for the children, and to help them get those needs met.
Yeah, I give an advocacy lecture that I've been doing for many years, and one of my first slides is a fishbowl with a bunch of goldfish in it. And it's always a little perplexing, like why the fish? But I grew up with like a fish tank in the dining area. And if you've ever tried to keep fish, you know that it's all about the water, right? Is it too much chlorine? Is the pH right? Is it too hot? Is there fungus in there? Did you accidentally put a predator in there with the fish? And hey, it happens. And that's kids. They're the fish, and we could try and treat them individually, but really it's about the water. Do they have healthy food to eat? Do they have safe green spaces to play in? Do they have water and air that is good for their development? Do they have a safe family structure? And those are all elements that are social constructs. They're not things that we can do a ton about in the exam room. I work in a community health center where we can do more than most places about those things, but it's still systematic. And there's a difference between getting a social worker to work on stable housing and changing the wage structure so that people can afford stable housing, right? That's a different thing, and making it easier to buy or to build low-income housing so that people can find what they need. That's the difference.
So before we move on, I'd like to take a moment to allow David to fangirl over Seema Yasmin, or Dr. Yasmin.
Yes.
So please go ahead.
Thank you. Yes. So aside from the fact that, I think and talk a lot about medical communications, misinformation, disinformation, the same things that Dr. Yasmin has built a career around being a master of, I have also taken stand-up comedy lessons and gone up. I wrote the only, as far as I know, pediatric humor column ever for Pediatric News for a while. And she casually mentioned that she has done stand-up and done that at the Comedy Center or the Comedy Cellar. I keep getting that wrong. The Comedy Cellar in Los Angeles, which is like, you don't just lightly go up to the Comedy Cellar, right? That you got to be somebody. And so aside from the fact that she is a leader in a field that I feel strongly about, she's also gone up at the Comedy Cellar? Come on. That's crazy. So yeah, I was actually a little starstruck.
All right, well, let's maybe move on to our plenary sessions from today, where we had 4 excellent speakers. I wanted to start with the first, which was actually, we had more than 4 speakers because we had 4 topics. This one had 2 speakers, both Dr. Perry Klass and Claudia Resti, talking about reading. And I loved this session. I think it really relates to what you were just talking about, David, about the water that kids are swimming in. What sort of environment are they being raised in, and what do we have the opportunity to affect within our clinical session? So I would love to hear more about your takeaways from that.
Well, I want to fangirl one more time because that's my mode. But Dr. Perry Klass started writing about her journey into pediatrics as a medical student. And that was at a time that I had a subscription to Discover magazine that is no longer, I think. And she had a column there. And I started reading her then. And I thought, oh, this is so cool what this person is doing and writing about. And I have followed her writing and been a huge fan. And then as I became involved in the academy, I actually got to meet Perry Klass and, tell her what a huge fan I was and what a role she had in me thinking pediatrics would be interesting. And now I have the privilege of actually considering her a friend and being able to send my own writing to Perry and say, hey, what do you think of this? Would you edit this? Do you like this approach? So taking somebody that I was just like, oh my gosh, I can't believe I know this person, and actually having them as a mentor in my professional career and just as a lovely human. And that's just outside of the incredible work that she's done. All the practices I've worked in have been reach out and read practices, and the joy of sharing those books with kids and getting to sit down and model the reading, if you can actually spend, a few pages of the book and talk about it. So yeah, I'm nuts. And then Claudia Aristi, look, I just switched into that for a second.
Was very impressed.
Thank you. She not as good as Joanna, actually, who was raised by a Cuban dad, but Cuban grandfather. I'm sorry, that's dad. She also had this incredibly compelling story, and that was amazing to hear her giving back to this community from which she emerged and grew into a leadership position through the work of people like Perry Klass.
Reach Out and Read is just such an influential program, and Perry took us from kind of the early roots of it at Bellevue Hospital, which is, as she mentioned, the longest running public hospital in the country, and to the national program that David just mentioned, where everybody's using it in their clinics and everybody's passing out books to read. And I am just waiting for there to be a social media channel or something on pediatricians' favorite books, wouldn't that be so fun to see? Because I think here's the thing, it's something that we can all agree on too, right? Books are amazing, books are relationship building, and Claudia talked so eloquently about early relational health and how she came to this country not even speaking the language and pregnant and a teenager, and how she's risen to being such an important figure in Reach Out and Read, I think just speaks to the power of the program and how it helps grow and develop minds, and hers included. And there were so many wonderful stories embedded in that plenary session that are so inspirational and that are so attainable, I think. And that's why I loved it for the plenaries, because it was something that we can all just do. Like there's donated books everywhere. Hard copies of books, especially for really young children, are easy to come by and easy to pass down. And so it doesn't even have to cost money. It can just be a little bit of time and donations and other things to get these books in the hands of families who will really cherish them. And who doesn't love a good book? What is your favorite pediatric book?
All of Sandra Boynton, anything. You just drop a Boynton book in my hand and I am just
Dinosaur Dance,
so
have you read that one?
Tickled. No, I was thinking Moo Ba La La La.
Oh, well, yeah.
And Hippos Go Berserk, which is... Yeah, there's a lot of... I could go on.
Yeah, she's a classic. We'll leave it there, but there are many others.
Yeah, I just want to say, I remember being a kid going to my pediatrician's office and getting a Reach Out and Read book and being so excited and like comparing books with my sister when my mom would take us both for our well child visits. And sure enough, I went on the website. I was like, maybe I'm just conflating memories. But yeah, my pediatrics clinic is there. And I was blessed and so excited by this program. So it was really amazing to see them speak and share on what their vision is.
And there's a new, I think it's a policy statement and a technical report outlining that the AAP launched today. So it was a big deal that Perry and Claudia came out to talk about it today, because we're also just kind of rethinking that program and how it can move into the future and how many more lives it can influence. And your personal story is so amazing.
I think the timing, it was really amazing to have this presentation just as this technical report was coming out. And for me, the anecdotes are definitely the most touching, but the technical report provides that level of evidence to back up what we all kind of know intuitively, that introducing children to reading early has these lifelong benefits, and then going and seeing all of these clear outcomes on the technical report provides perhaps that additional push that policymakers need to help support this program, that clinics need to decide to enroll. So it was just all in all a very inspirational and actionable presentation, I think.
I love the fact that these masters of story used story to explain the importance of story. They know what they're doing.
Yeah, we also had a great talk on social media, and as someone who is simultaneously kind of a little bit removed from it as a younger trainee versus, but still kind of close to it, I still have trouble with navigating this. I think I see a lot of my practice and how do I talk with teenagers, young adolescents about this. We had a great talk. It was Jenny Radesky and Megan Marino, who are the co-directors of the AAP Center of Excellence on Social Media and Youth Mental Health. And they talked a lot about how to discuss social media with kids. What are y'all's takeaways from that?
Yeah, and I don't know if we want to say the 5 C's, because I think is the biggest takeaway.
That was
It was new to me.
Yeah.
So the first C, child, right? You're focusing on the kid.
And then content. So what are you looking at? As you kind of mentioned, there are so many different platforms and so many different forms of media. So how are you getting that media and ingesting it?
And then there's calm. I think there's a tendency, let's say not a tendency, we've all done it as parents to instead of having the child build self-soothing skills, which is really difficult, we know that the electronics work for that, but then they're not doing the work, you're not doing the work.
And then crowding out. So what is media use taking away from interaction and relationships that you could be building with your kids? And when is it just providing noise and not providing stimulation that you want your kid to have to grow?
Right. And communication. Are the media getting in the way of the of communication as a family, or are you using them to enhance? Because you can do that. I have 5 kids with Christy, and we would use media enhanced games. We can't all get around a game board, the 7 of us, but we could get around Jackbox games on the big TV, right? And so, what are you doing if everybody's scrolling at their phone instead of talking to each other? That's not good. But if you're using it to enhance communication as a family, it's all about what are you doing with it? Not it's a good thing or a bad thing, but okay, what's the utility of it?
Yeah, and how do you talk about it with your kids? They can go online now and Google anything, right? Or spend their time flipping through YouTube videos. And so how are you talking to them about that? How are you? And I think Jenny did a really good job actually of taking some blame away from parents. I think parents can be really hard on themselves about media use. But these programs and these social media kind of apps and channels are meant to engage. And the people who created them not with kids in mind, but with the idea of, a bottom line and engagement and followers and money. And so sometimes pointing that out to your kids, especially as they get older and can comprehend that, is really important, right? So the structure is made such that it's going to entice youth. And she made a good point about how there's not these children's boards, like there's not advisory boards that include child advocates to be able to watch for the developmental stages of children and protect children in these digital settings. And so she took some of the onus off parents, because we tend to be a very individualistic society and put everything on the people. But like, we're up against these big companies that have made these products to engage.
And I do want to bounce back to crowding out just for a second, only because Jenny Radesky wrote one of the most masterful and hilarious articles ever to be published in Pediatrics, which was a social observation study of parents using absorbed in their own media while they were eating at a fast food restaurant with their children. And it was a 2014 study, and you'd have to go back, and I don't remember the name of it, but these very dry clinical descriptions of parents kicking their children under the table so that, they'd stop asking for more ketchup while they were scrolling Facebook, is both heartbreaking, but also because we were all familiar with it. It's like also there's that laughter of recognition of like, yeah, maybe I was that parent, or maybe I've seen that parent, so.
Are you a physician interested in seeing new jobs, but only if they're relevant and without all the recruiter spam? Or maybe you're a healthcare leader involved in recruiting physicians but find headhunters and job boards too expensive and inefficient. Meet Grapevine, a groundbreaking platform designed by physicians for physicians to bring a new approach to helping our community match with open roles. Unlike traditional job boards, Grapevine connects physicians to jobs through a trusted peer-to-peer network where referrals come from signed-up members who see the open jobs. This means candidates are recommended by those who know them best, other doctors who recognize their skills, strengths, and passions. So for physicians, Grapevine ensures trust by sharing detailed job listings only from one doctor to another, never a recruiter. Not only that, physicians can earn significant cash incentives for successfully making a match. For anyone hiring, this means allowing you to capitalize on the best recruitment method everyone already knows and wants more of: word-of-mouth referrals. We connect candidates directly to hiring teams and never an intermediary who might charge 20 to 30% of a physician's future salary. So if you're a physician, join Grapevine for free at www.grapevine.health/Cribsiders, and that's Grapevine with a Y instead of an I. By joining, you are not just a member of a new referral network, you're supporting a new solution designed to improve job matching, reduce excessive healthcare costs, and take back physician ownership of healthcare. If you're hiring, visit www.grapevine.health/Cribsiders, Grapevine with a Y, to see how Grapevine can bring physician-recommended candidates without breaking your budget. Again, that's GRAPEVYNE.health/Cribsiders. Grapevine, because physicians know physicians best. And join us today.
So I know we have to start running soon because I know Joanna's got a flight to catch. As we start to wrap up here, I just want to ask, is there any other big takeaways from the plenaries you guys have done these last couple of days, or other great takeaways from the AAP and C as a whole? Because you guys have done such a great job. You guys have been basically the MCs, the co-hosts for this convention for how many years now?
Yeah,
I know,
this
5.
is year
yeah.
5.
We got our 5 Timers Club smoking jackets at this point.
I mean, there's so much thoughtfulness in the planning. And one thing that I really loved about today was it bounced around to so many different topics. Because right after media was like syphilis. There's not really a connection there, except to say that, yeah. All right, let's talk about syphilis. That's not easy to make as any transition, but it was a practice-changing talk. I think it and I think it brought real awareness. Dr. Christopher Golden did such a good job of talking about how it's rising and also making us aware of it. Now we're starting to see these infectious diseases, and syphilis is not the only one, by the way. Like, we are actually seeing pertussis in Philadelphia right now. We are seeing infants in the NICU with pertussis. This is a vaccine preventable disease, right? So that even hits harder when you're a pediatrician because you feel like you could do something about it. But we're starting to see more and more syphilis. We can do something about syphilis. And I think he made me rethink a little bit my screening of it.
Me as well. So I do several things, but most of my clinical time is now spent as a newbornist and trying to think about what do we do with these syphilis antibody screens. And I thought, but he was like, no, you have to stop and think. the antibody screen turns positive before you get a positive RPR. And I have to admit, my thought process was like, oh, we got a negative RPR, we're good. And he's like, no, you're not, right? Like, you're not out of the woods yet, So you got to get the TPA.
Additional testing.
Additional testing.
You have to get the additional testing with lots of letters.
So good.
And then you have to interpret it against the risk of the parent involved. And so it was really gave a lot of depth.
And determining risk is hard, because it could be the person who's been married and having their fourth kid, and you wouldn't think there would be a risk of syphilis, but there's, we're humans, and so relationships change. And so I think he brought up some interesting points about, how do you screen? Who are you screening? How do you keep it equity-based, and how do you not make assumptions about the families that we're treating in the moment? So that was great. And then to have Admiral Rachel Levine come out. So I'm in Pennsylvania, so I have been following Admiral Rachel Levine's career since before she took the national stage with Health and Human Services, because she is a Pennsylvanian. And she, under Governor Wolf, our previous governor before Josh Shapiro, was appointed to our own health bureau. I don't know the official names in Pennsylvania, but I've been a fan of hers for so long, and she just is so passionately fighting for the rights of all people, and I love that about her. And I think that's what really shone through. I don't know what shone through enough for everybody else about her speech, but
in a 15-20 minute speech, she went all the way from talking about the different data-driven national objectives to improve health, from adolescent medicine, mental health, chronic health conditions, social determinants of health, climate change. Then she sort of closed off with this food as medicine initiative that they're doing. She just ran the whole gamut, and it was just really inspiring about everything that we're trying to do. And with as much as she talked about, I think you can easily get there's just so much that we can't do. But I think her message was that, no, these are things that we can do something about, and that we're working on it. There are initiatives like food as medicine. So I thought it was a really great speech.
Yeah, I think Admiral Levine is one of those people cleaning the whole fish tank right now for us to bring it back. By the way, to bounce back to another thing, it was FTA, ABS, and TPPA, which is, to be fair, most of the alphabet. But no, when you think about trying to deal with the systemic issues that affect child health, the fact that Rachel Levine is up there at the highest levels of government and really cued in to what those things are is absolutely critical.
And I think she's just a great example of a person who doesn't make it about herself, but makes it about the issues and how passionate she is about the issues, and really tries to draw people together because we should have this shared desire to help. And I just thought her call to action was so wonderful because of that too.
I think that ties in really nicely with even the opening session about being as a superhero, really up against a great challenge, but really is fighting the good fight for those helpless children.
Well, thank you guys again for sitting with us a second time. Hopefully we can do this more often. It's just fun to talk to you guys, and we also love coming out here to the National Convention all the time.
Should we do it in Denver?
Oh, yes, we totally should.
Let's go. We have heard that podcasting is really taking off as a medium, and so we're just excited to be here.
The air in the room is different in Denver. As a neonatologist, I know this intimately.
Well, thank you guys again. I know you have to get going, but thank you.
Thanks.
Thank you. Thanks for having us on.
This has been another episode of the Cribsiders.
It's for the kids!
Get show notes and sign up for our weekly Knowledge Food Formula Feeds newsletter on our website at www.cribsiders.com.
We're committed to providing you high-value, practice-changing knowledge, and to do that, we need your feedback. So please subscribe, rate, and review the show on Apple Podcasts, or contact us at thecribsiders@gmail.com. A special thanks to our producers for this episode, Dr. Avram Rago, Dr. Avram, Sydney Engel, Joan Park, and our showrunner, who was here but was not able to make our recording, Dr. Sam Mazer, and our wonderful social media team on Twitter and Instagram. I have been Chris the Chimanchu.
I've been Avram Rago.
I'm Sydney Engel.
And this has been Joan Park. Thank you and good night.
And I don't have an AI poem, so see you guys.